All right, so today we're going to be talking about the new 988 Suicide and Crisis Lifeline. And we have Emily that's coming to kind of do this for us from the suicide prevention. She is a suicide prevention coordinator. I almost messed that up, from MDH. Where'd you go, Katie? Announcements. Remember, on November 2nd, the author of Dreamland will be on our Echo. That should be a fabulous show. And we're really excited to have him. We're probably going to be in Nashville doing that live with him. So just be aware that it's nice. The only thing, he didn't ask for a nickel to come on, but what he wants is for people to have read the book so that the discussion he has makes some sense to you. So please feel free to pick up his book or borrow it from somebody. It's one of the award-winning books, especially with Amazon. It's one of the top books in 2020. Next slide. So upcoming, we got a lot of stuff coming down the pipe over the next month or so, but I think next week, particularly interesting with Charlie Resnikoff coming back from Hennepin, going to be talking about kind of legislative update. And then the following week, a little bit on gambling, which is always fun. So lots of good talks coming up. Please kind of check those out. Remember, there is free CME, still free. It's all free. And again, doubled if you have your video on, because Emily wants to see your beaming face today. Remember, if there's more than one person in your room, please let us know if they want CME so they get that. Again, if you want some technical assistance, you see Erin on here. I think her face is still on. You can call her. There's her cell phone number. Heather and I, you can call us anytime if you have questions about patients or things that you need help with, or just some guidance. So please feel free to reach out. And remember, online, we have a lot of education. A lot of our education stuff is going to be out completely online. Some of the things, especially with our manual, with some of the protocols and such, will be up soon. It's being reviewed by MDH right now so that we can put it on there. Next, again, the Addiction Connection podcast. I'm trying to remember what we did this week. Oh, it was on older adults and opioids. So if you want to check that out, there's 121 different episodes now. We just switched actually to a different platform. So it's been tons of fun with that, doing that. It's one of the most fun things we do. So please feel free to check that out. And so now we will move to Emily. And Emily, maybe you want to introduce yourself a little bit about it, kind of exactly kind of what you do, and then you can share your slides. And thanks again for coming to talk to our group.
Yeah, absolutely. Happy to be here. And thanks for inviting me to share more about 988. I'm going to try to put up my slides at the same time as talking. So like Kurt said, my name is Emily Lindemann. I'm a suicide prevention coordinator, and I work in our suicide prevention unit at the Department of Health. And in my role, what I do is I oversee and coordinate just all of our activities related to 988. So for today, what I'm hoping to do is just share about what we're currently doing with 988, the transition, and happy to answer any questions that folks might have. Kurt, can you just give me a thumbs up if you can see my screen?
It is
my
perfect.
Slides. All right, thank you. So we'll just dive right in. If you are familiar with the National Suicide Prevention Lifeline, that has now transitioned to the 988 Suicide and Crisis Lifeline. It went to effect on July 16, 2022. So what you'll notice is that there's a name change to the Lifeline now, and part of that is to broaden the scope of the Lifeline that people call into the Lifeline for more than just thoughts of suicide. It's being broadened more to mental health and substance use crisis as well. Some of the things that you might have heard is that 988 is a new service, and it's actually not a new service. It's a new 3-digit dialing code, but what it actually does is it builds upon the existing infrastructure of the National Suicide Prevention Lifeline. So regardless of whether you call the 1-800 number or 988, you're still going to get connected to the same service and the same centers who are answering those calls. So I just wanted to provide a little bit of background about how we got to where we are with 988 today. I mean, a lot of this started back in 2018 when Congress asked the FCC to do a study on the feasibility of having a 3-digit number for the Lifeline. And so the FCC partnered with SAMHSA as well as the U.S. Veterans Affairs to do this study. And what they came back with and reported back to Congress was that there was value and benefit in having a 3-digit number for the Lifeline. And so the FCC designated 988 as that new 3-digit code. So kind of scrolling into 2020, the FCC made their final ruling, just really solidifying that 988 is going to be this new 3-digit number, and that all the telecommunication service providers in the United States had to make dialing 988 operational by 2022. And kind of at the same time as that, Congress also passed legislation just to kind of solidify all of that information. And then in 2021, the FCC came back and made a second ruling saying that allowing texting to 988 to a 3-digit number. And this is important because typically when you text to a number, it's a 5 or 6-digit code. So having a 3-digit code is, it has to get that permission from the FCC. So they granted that. And then kind of here we are at post-transition of 988. We know that there's going to be more information to come, but those are just kind of some of the highlights that kind of led up to this point that we're at. So just a little bit more about the Lifeline Center itself, or the Lifeline itself. It started back in 2005, and it's funded through SAMHSA. And the way the Lifeline actually works is that it's a nationwide network of over 200 local crisis centers that are located in states all across the US. And so only centers that are part of the network are able to answer the calls that are coming into 988. And to be a Lifeline center, you have to meet certain standards and requirements and accreditation. So I can't just have my own call center and start taking 988 calls. There's a kind of an application process that an organization would have to go through. But really the purpose of the Lifeline was to serve as that one universal entry point so that no matter where you lived, you would have access to a trained crisis counselor. So the big takeaway here is that it is a national program, but it's localized service. So if you're calling from Minnesota, a Minnesota Lifeline Center would be answering your call. And I'll talk a little bit more about that in my next slide. So here in Minnesota, we do have 4 Lifeline centers that are designated to answer these 988 contacts that come in. And they cover all 87 counties in our state, and they operate 24/7. And really the purpose is providing that support for anyone who is having thoughts of suicide, mental health or substance use crisis, or any other type of emotional distress. So there are 3 ways to contact the Lifeline. Previously, we've primarily been promoting just calling in, but with the expansion of 988, we are promoting all 3 different modalities that people can connect to the Lifeline. So the first being calling 988. I do want to note here that calls are routed based off of a person's area code. It's their area code and the first 2 digits of their phone number. And I know that's not a perfect system because a lot of people live in Minnesota who don't have a Minnesota area code, or people who have a Minnesota area code that no longer live here. And so it's not a perfect system, or it's not a perfect way to route calls, but until the FCC makes additional decisions, calls will be routed based off of your area code. But similar to how the previous Lifeline worked was that when you do dial 988, you'll be prompted to press 1 if you are a veteran or a current service member and want to be connected to the Veterans Crisis Line. You'll also be prompted to press 2 if you want to be connected to the Spanish language subnetwork of the Lifeline. And then if you remain on the call, your Lifeline will be routed to one of the 4 Lifeline centers in Minnesota. The thing about 988 is that it does require active phone service to use it. So a person needs to have some type of subscription to a telecommunication service in order to make that 988 call. But all 4 of our Lifeline centers do have access to third-party interpretation services that would be available for anyone who needs that interpretation services when they're connecting to 988. The other way to connect to 988 is through chat. So if you go to 988lifeline.org, there is a little button that you can press that says chat now, and you do have to just put in a name or an alias that you want to use and a zip code, and that's how calls are routed to. That's how they know where to route the calls, is based off of your zip code. Right now, chat is only available in English, and then very similarly to chat, we have text, which is texting to just a 3-digit number. So any device that is able to send and receive text messages would be able to have that service provided. It is routed based off of your area code, and the service is only available in English at this time. So I do want to just talk a little bit about 988 as a distinct service from other crisis support services that might already exist, or ones that you might be more familiar with. So 988 does provide that confidential service and support to anyone who contacts the Lifeline. People contact for listening and support, information and referrals, and also crisis intervention. It's a space to talk openly about suicide, mental health, and substance use. And it's also a place to receive education. A lot of times people call because they are worried about someone, or they're not sure what resources are out there. So they'll call, and the crisis specialists are able to provide some of that information for them. The Lifeline does also offer some very limited follow-up calls, which is essentially asking the caller if they would like the Lifeline to call them back anywhere between 24 to 72 hours, just to check in and see how they're doing, if they need additional resources or additional information about services within their community. So what 988 is not, it's not a support line. It's not a pure support line. There are warm lines within Minnesota who could provide that peer support work. It's also not a space to solicit advice. The crisis counselors are there to provide support and listening. And it's also not a place to have a mental health or physical condition diagnosed. And then probably one of the most important things I wanted to just highlight here is that 988 is not a response service. The support that you're receiving is that dialogue or that conversation that you're having with the crisis specialist. So they do not respond in person. If a person calls 988 and is in need of some type of in-person response, 988 would be able to connect that person to either a mobile crisis team or to 911 emergency response for that more higher intensity level of response. So 988 is not meant to replace mobile crisis teams or stabilization services or emergency services or any other dedicated lines. It's meant to help enhance what's already there and help just kind of be another avenue that folks can access if they are in a crisis. So I borrowed this slide from one of our Lifeline centers. It's kind of the Lifeline approach to calls. And so all crisis counselors are trained to have that person-centered training, trauma-informed, approaching callers with empathy, non-judgmental, confidentiality, and cultural humility. So our Lifeline centers do an extensive onboarding process for their crisis counselors before they start taking those calls. Then I just wanted to highlight some of the reasons why people call. I know earlier I mentioned that people call for more than just suicide. So this is just a broad range of things that our crisis centers have experienced in why people reach out and why people connect with the Lifeline. So it ranges from suicide to loss to parenting, just to relationships, a whole variety of things. All right, so what happens when you call 988? Every person who calls 988 is screened for suicidal risk. And then kind of based off of that, the crisis counselor would be able to engage with them and kind of use the assessment model here. This is what the 988 Suicide and Crisis Lifeline has as their model for safety assessment. It doesn't always flow in this, so just depending on the conversation and the situation that the caller is in, they might jump around this kind of this cycle. So once they connect with a crisis counselor, the assessment for for risk is done, and then if a person's at high risk, that might lead to a different scenario versus if someone was at low risk and was more looking for that listening and support. But one of the things that the crisis counselors always do is they always try to work actively with the callers in identifying coping strategies, identifying if there's family and support or family and friends who could help support the person through a crisis. And then if there are any ways to reduce access to lethal means and safety planning. So I do want to just kind of go back to this part about asking about suicide. So when someone calls a Lifeline, the first 3 questions are asked to everybody who calls. If a caller answers yes to any of those 3 questions, they would move into a more in-depth risk assessment. So they'll then ask, has the caller taken any steps to harm themselves today? And is this an attempt in progress? And how the Lifeline sets up their risk assessment is it's a combination of the Columbia risk assessment model, as well as the safety assessment model that was developed by the Lifeline. And that's what crisis counselors are using to determine, is this a call that needs to go to 911 for an emergency response? Is this a call that potentially could go to a mobile crisis team? Or can the crisis counselor talk with this person and help this person maintain their safety? So I do want to talk about imminent risk. And in the world of 988, imminent risk is determined by someone's desire, intent, and capability to end their life. So as the crisis counselor is talking with a caller, they're looking for these things. Does this person are expressing ideation for our suicidal ideation? Is this an attempt in progress? Do they have a plan or a method of how they're going to carry out ending their life? And then they're also looking at, does this person have a history of suicide attempts? Does this person have access to lethal means? And so at the same time as all of this, crisis counselors are also listening for whether or not this person has immediate supports, those buffers. Are they talking about reasons for living? Is there anything that could help reduce that risk, that imminent risk level? And so the Lifeline trains all of their crisis counselors to use the least invasive means whenever possible for that intervention piece. So I'm just going to, so this next slide has a lot of words on there. This is their statement regarding imminent risk and that connection to other services, particularly emergency services, calling 911. And the expectation of crisis counselors is that they should be contacting 911 for assistance when there is an imminent risk to someone's life or others, or the person involved is not able to maintain their safety or consent to maintaining their safety. So I do want to just provide a little bit of information kind of on how often this happens when a handoff needs to be done. So this was just some data that our Lifeline centers shared with us from almost the full 2021 year. But overwhelmingly, you can see that most of the calls are resolved on the line without having to make that connection to a mobile crisis team or to 911. So what we see here is we have about 1.7% of calls that were transferred to a 911 dispatch center last year, and then 1.6% of calls transferring to a local mobile crisis team within the state. So I get this question a lot about 988 and mobile crisis. So mobile crisis teams do cover all 87 counties in Minnesota. The size of the team just really varies across the state. Some mobile crisis teams cover just one county, while other teams cover up to 10 counties. And mobile crisis teams are supported through the Department of Human Services. But when Lifeline centers are thinking about transferring a call to a mobile crisis teams, what they are really assessing for is the imminent risk of a person. So if it's an attempt in progress, that's likely not an appropriate call to be transferring to a mobile crisis team. They'll transfer that call to 911 instead. They're also looking at consent to care. So in order for a 988 team to make that transfer to mobile crisis, the caller needs to consent that they want to be connected to the mobile crisis team. If the caller is saying they don't want the mobile crisis team, then the Lifeline centers are going to respect that decision and not make that transfer. They're also looking at medical concerns. If there are other medical concerns that are present, they won't transfer that call to the crisis team. And then they're also looking at intoxication and whether or not the person is under the influence and whether that's appropriate to transfer to a mobile crisis team. I do want to just share a little bit about third-party calls. So this does happen, and how we define a third-party call is when someone calls not for themselves, but because they are worried about somebody else. So sometimes you might have a parent who calls about their child who lives in a different county or in a different city. So what the crisis centers do is they will assess for the person's safety of concern to the best that they can. They do provide that education and support to the third-party caller and how they can help increase the safety for their loved one that they're calling about. They are going to take any steps necessary to ensure and increase the safety of the person who they're calling about, and then providing support to the third party themselves about any support that they might need. A a crisis counselor may try to reach out to this person of concern if the third party wants them to, but I, but that might not always be the case, and that's not a standard practice that all of the Lifeline centers do. The person might not pick up, they might not want to be contacted. Um, there's just a lot of variables in that space, but our crisis counselors do try to support the third party caller as much as possible. I briefly mentioned this a little bit earlier, but wanting to just kind of loop back to the part about information and referrals. So all of our Lifeline centers do have access to the 211 database that provides a listing of community supports and programs. And so what they will do often is provide callers with those resources that meets their specific need in their specific community. So if a caller is calling in about food insecurity, and that's part of why they're calling in, the Lifeline Center would be able to provide them with the address or the location of a local food pantry in their community that they could reach out to. So they do provide some of those information and referral calls. Our Lifeline Centers staff may also collect demographics information, and it's really only for the purpose of providing specific resources. So one of the things that we've been looking at is if a tribal member called and wanted to be connected to specific tribal resources, that would be important for our Lifeline centers to know how to connect a person to specific resources. Or if someone's calling in about wanting like a specific resource, having some of that demographic background will be helpful in kind of pinpointing which resource to provide the caller with. And then about the follow-up calls, again, like I mentioned, it's essentially receiving a call back within 24 to 72 hours after the initial contact. A person does have to consent to wanting a follow-up call. So if a person says, yes, I would like you to call me back, the crisis counselor would take down their information, and the center will give them a call back just to check in. And the purpose of that check-in is to see how they are doing, seeing if they are using their safety plan, if there's any updates that they need to make, to see if they were able to connect to the resources that were provided, or if additional resources are needed for that caller. So what can you do? We are encouraging all of our partners and providers across the state to engage with local partners in your community to determine how you guys might use 988. The other part that I do want to talk about is the phase out of the 1-800 number from existing promotional materials. So we know that a lot of clinics and hospitals or programs out there have the 1-800 number on pamphlets or information that they're handing out. So what we're asking is for folks to take a look at their website, their digital materials, and update that information with 988 Suicide and Crisis Lifeline. For any printed materials, what we're asking is that you don't just throw away the materials that you currently have with the 1-800 number on there. We absolutely encourage that you continue to use those until you don't have any more. But what we're suggesting is that you do not print new materials with the 1-800 number on there, that you go ahead and make those updates with the 988 number. And again, like I mentioned, whether you call the 1-800 number or 988, you're still going to get the same service. It's connecting you to the same place. We just kind of want to ensure that we are phasing out that 1-800 number and having 988 be that public-facing number that we promote. If you want information about updated promotional materials or the new logo for the 988, it's all located on SAMHSA's website, and I have the links available for folks who want to download those and have information updated there. So just to kind of wrap things up, I do want to just touch on a couple of things that we get questions on a lot. One is being the Veterans Crisis Line. I do want to just emphasize here that the people who answered the Veterans Crisis Line are different from the crisis specialists answering 988. So if you dial 988 and then press 1, it will not go to one of our 4 Lifeline centers in Minnesota. The Veterans Crisis Line is operated through the VA, so it has a different mechanism of how that works. Prior to 988, the Veterans Crisis Line had their own chat. So that has not changed. You would go to the Veterans Crisis Line .org website and would be connected to chat there. And then also prior to 988, the Veterans Crisis Line had the availability of texting in. So if you are a veteran or a current service member and you want to text in to the Veterans Crisis Line, you would text 838255 instead of texting 988. At this time, I don't think there is a way for you to be transferred if you're texting. So if you text 988, I don't think there's a way for them to transfer you to the Veterans Crisis Line. So just wanted to flag that for folks that chatting and texting has not changed for the Veterans Crisis Line, but the 988 number has. So you can dial 988 and press 1. Let me go here. So the other piece that I get a lot of questions about is the crisis text line. The crisis text line is a separate and different organization than the 988 Suicide and Crisis Lifeline. So I think of them as like Costco and Sam's Club. They're very similar. They both offer crisis text support, but they're ultimately 2 different organizations that are operating. So the crisis text line has not gone away. It's still available. And if folks want to text into the crisis text line, they absolutely can. You would just text home to 741-741 and be connected to a crisis text line specialist there. And then similarly to 988, it is free and it is available 24/7 for anyone in the U.S. with that ability to send and receive texts. So I added this slide just to kind of demonstrate the long-term vision that SAMHSA has around crisis services. So this is goal for the next 5 years. And so their first phase is really working on that someone to call piece, which is the Lifeline Center, wanting to ensure that people have access to crisis help if they need that support. But kind of on the horizon is that SAMHSA is looking at mobile crisis services, and they're also looking at stabilization services. So it's great that people have someone to call, but if no one is there to respond for in-person response, or there's nowhere for folks to go, then it's not a complete, robust crisis system. So just wanting to let folks know that long-term SAMHSA is looking at building out the entire crisis care continuum, but they're first just focusing on a lot of those 988 pieces. And then the last thing I wanted to just say is that 988 really is just that first step. We know that it's going to take much longer to build the crisis system into what we would all like it to be. And so we're really excited with this transition and are looking forward to partnering with our state partnering agencies and community partners across the state to really determine how we can have this work better for people who live in our state. So I have some resources here that folks can take a look at afterwards. We do have some crisis resources from that are MDH branded that folks could print off and use with the 988 number on there. We do have a 988 webpage on our MDH website that folks can go if they want updates or information about 988. And then just the logo and branding from SAMHSA, as well as the social media shareables and partner toolkits that SAMHSA has available for anyone to use. And with that, that is all the information that I have today, and I'm happy to answer questions.
Oh, there's questions. There's always questions, Emily.
Good.
So a couple things. What happens if somebody calls and is busy?
Yeah, so I don't know the exact wait time in there, but it gets bounced to, so if you call a Lifeline center and they're unable to pick up within a certain amount of time, it actually rolls over to our in-state backup center. So one of our call center is also designated as our in-state backup center. So
Okay.
for example, if Greater Twin Cities wasn't able to take the call, it would get routed to our backup center first call. And if they weren't able to pick up the call, the Lifeline actually operates national backup centers who take the overflow from every state across. So there's a mechanism to have calls answered.
Perfect. So the people that are answering the phones, what kind of qualifications do they have to even apply?
Yeah, so most of them are at that practitioner level. I don't know what it is for every center, but I know some of our centers, it's at least a bachelor's degree or X amount of experience in the field to qualify.
Okay. Do you, any idea of like what the breakdown is? How many people actually call? How many people text? How many people use the chat? What the percentages are?
Yeah, I don't have it in front of me, but I know the 2021 numbers, most of the people called. And I think last year we had over 33,000 phone calls, over 4,000 chats, and about 1,200 text messages. But what we've seen is that this year we've really started promoting chat and text for people to use as well. And so since the transition to 988, we've seen a 250% increase in texts. And then we've seen over 175% increase in chat as well compared to last year. So we are seeing that those numbers are increasing.
Wow, that's interesting. When you talk about that, if you have to get consent to kind of transfer them to a crisis team or something like that. I mean, what happens if you have somebody who's clearly a danger to themselves? And, do those things still hold true?
So if the primary purpose, or not the primary purpose, but at the forefront of what the Lifeline centers do is trying to save lives and trying to make sure that people can maintain their safety. If someone is unwilling to consent to reaching out to a mobile crisis team and the crisis counselor feels that this person, if something doesn't happen, this person could could harm themselves, they will break that confidentiality and make that connection to 911 for services.
I would assume that'd be the same if they felt they were a danger to others, correct?
Correct. Yeah.
Okay. How about repeat callers? I mean, there's got to be times where they're calling back all the time, and almost some of the people accepting the calls recognize them. Is there some different steps they take?
I don't know exactly what the protocols are for those, but I do know that at the national level, the 988 Suicide and Crisis Lifeline do have policies and steps for crisis centers to use if they are getting frequent callers or frequent callers that are having inappropriate conversations with crisis counselors. My understanding is that there is a mechanism to kind of handle some of those calls.
Yeah, oh, that's interesting. One of the things that you see when you look at, for instance, paramedics or people that are often dealing with people in crisis is that they need help themselves. Is there any kind of services for the people taking the calls?
Yeah, with our Lifeline centers, they might have their own internal like EAP system or their own internal policies around that. I do know that the Lifeline Center, or not the Lifeline Center, then the Lifeline itself at the national level, they do have a team that is dedicated just for that can help support Lifeline centers through policies or through suggestions to kind of help with that compassion fatigue or staff burnout.
Yeah. I can't imagine that doesn't get a little hard sometimes. I mean, especially when they're dealing with people that are, always in crisis, right? You never get the break. So how about, one of the things that's interesting to me is that when you talk about third-party callers, what if they're talking to a third-party caller and do they ever dispatch the police to do welfare checks on the advice or the concern of a third-party caller?
Yeah, that's a great question. And I don't know the answer to that question. Okay. I don't know the answer.
Perfect. Okay, that's okay. You can't possibly have all the answers. There's a million questions. So I don't know if anybody else has any other questions. I kind of went through Dr. Heather's since she had to log off and through some of the ones I had. Anybody else with any questions or thoughts in regards to this service, which obviously based on the numbers you threw out there, it's very much needed, right?
I had a question for Emily. You mentioned this expands beyond suicide and you mentioned substance use disorder. So what does that look like when someone calls? Like what kind of information are they offered if they're in crisis with substance use disorder?
Yeah. So our Lifeline centers do have information about what programs or what services might be available if someone wants to be connected to some of those substance use. I will say that the substance use piece is new for the Lifeline. In the past, they've been primarily trained to de-escalate suicide and mental health crisis. So I know that this is a new piece that they are navigating as well. I want to say that the Lifeline is going to come out with additional trainings for Lifeline centers so that they can share that with their staff. But I don't know exactly how that looks right now in practice with that.
Perfect. All right. Well, I tell you what, I learned a ton, Emily. I think that often I was not real sure, what we would who we would give this to or what advantage it might have. But, clearly as a service, I think this is just amazing for patients to be able to connect to. So really appreciate very much you coming on and sharing this.
Yeah, absolutely. And I'm happy to follow up with any questions. If folks want to email me, you can. I'm available to help answer or make connections to our Lifeline centers.
Yeah, and don't be surprised if a year from now we pop back in your inbox and say, hey, we'd love to know what's changed, what's working. I'm sorry, I'm plugging in my computer because it's about to die. what's working, what's not, and what new services or how things have changed over the next year. So really, really interesting stuff.
Yeah, absolutely happy to provide updates at any time.
Perfect. All right. Well, everybody, thank you for coming again today. We will see everybody next week when we have Charlie Resnikoff talking a little bit about legislative things that are happening. So please feel free to come on to that, and we will see you. Have a great rest of your week.